The Anatomy and Physiology Laboratory presents the skeletal system. The first one will be palpating the surface anatomy of the lower limb. Number 1. The greater trochanter of the femur. This is easier to locate in women than in men because of the wider pelvis. Also, it is more likely to be covered by bulky muscles in men. Number 2 is the patella and tibial tuberosity. Feel the kneecap or the patella and palpate the ligaments attached to its borders. Follow the inferior ligament to the tibial tuberosity where it attaches. Now the third one is the lateral malleolus. Feel the bulge of the lateral aspect of your ankle, the medial malleolus of the fibula. The fourth one is the medial malleolus. Feel the medial protrusion of your ankle, the medial malleolus of the distal tibia. Number 5. Calcaneus. Attempt to follow the extent of your calcaneus or heel bone. Now let us move on to the next part, which is demonstrating movements of the synovial joints. First one is the flexion, a movement generally in the sagittal plane that decreases the angle of the joint and reduces the distance between the two bones. Extension, a movement that increases the angle of a joint and the distance between two bones, straightening the knee or elbow. Abduction. Abduction is the movement of the limb away from the midline or median plane of the body, generally on the frontal plane or the fanning movement of fingers or toes when they are spread apart. Adduction. Adduction is the movement of a limb toward the midline of the body. Adduction is the opposite of abduction. Rotation. Rotation is a movement of a bone around its longitudinal axis. Circumduction, a combination of flexion, extension, abduction, and adduction commonly observed in ball and socket joints like the shoulder. Pronated, supinated, pronated, supinated, pronated. Inversion, reversion, inversion, reversion. Plantar flexion, dorsiflexion, plantar flexion, dorsiflexion. And that ends my presentation. Thanks for watching.